In this presentation, I was aiming to say something about how COVID might have influenced people's sleep. And there has been, as you all know, a lot of publications generally on this topic. So I decided actually to focus on meta-analysis to try to sum up the field, focusing on meta-analysis only. So I did searches in PubMed, Web of Science, and PsycInfo with the string sleep or insomnia or circadian combined with COVID-19 and meta-analysis. And of course, I guess that string will not cover everything which has been published, but I guess that most of the relevant publications will be identified through this search. The inclusion criteria was that the study had to present data based on a meta-analytic methodology, had to be published in English, and had to include data on sleep or sleep-related constructs such as insomnia or sleep problems or something like that. So when I did the search, I identified 180 potential studies. After removal of duplicates, I was left with 112 studies. I did not exclude any study based on title and abstract only. So I went through 112 studies and I excluded those who actually were not meta-analysis, who did not report any data on sleep and that were not published in English. So that was 66 records that was excluded, and I was left with actually 46 meta-analysis on the relationship between sleep and COVID-19. So I don't think we have time to go through I've made one slide for every single meta-analysis I identified. I don't think we have time to go in detail through everything, but for those who would like to have this presentation afterwards, I guess you, Ian, can publish it on the website of Obtentia. But I divided the studies into different categories based on basically the topics, and by far almost all of these meta-analyses concerned in some way prevalences of sleep problems following the pandemic. And I divided it into different populations. Some studies looked at mixed populations, 11 meta-analysis. Some looked at the sleep problems in general populations, in healthcare workers. That was the highest amount of meta-analysis. 16 meta-analysis looked at sleep problems in healthcare workers due to the COVID-19 pandemic. And some looked also into the prevalence of sleep problems in students. And a few, only 4 looked into sleep problems in COVID-19 patients. And also some looked at specific populations. And one meta-analysis investigated the prevalence of sleep problems in post-COVID syndrome. 3 interesting studies looked at how sleep is a prognostic factor for outcome of the COVID-19 infection. And actually, all of those studies looked specifically on how sleep apnea, which is a quite common sleep disorder, is a prognostic factor for the outcome. And then I identified also one meta-analysis which looked at effects of interventions on sleep in COVID-19 patients. So we'll present some of these data, some of these meta-analysis, and also at the end try to sum up the field in general, and also point to some, in my opinion, clearly significant methodological limitations inherent in this field. So first I will start to present some of the meta-analysis which has been done on mixed populations. In these meta-analysis, one has typically assessed the prevalence of sleep problems in healthcare workers and the general population at the same time. So the first meta-analysis is a meta-analysis including many cross-sectional studies, and actually the field in general when it comes to the prevalence studies are mostly cross-sectional. That goes for all meta-analysis I have been able to identify. A few longitudinal studies were also identified in this meta-analysis, and it included the general population, 105 single studies, healthcare professionals, and COVID-19 patients. And here is the result. And this is the pattern which actually emerges in most of these meta-analyses, that the prevalence of sleep problems is clearly highest in the COVID-19 patients themselves, but also that the healthcare professionals has a higher prevalence of sleep problems compared to the general population. And in this meta-analysis, longitudinal studies showed higher prevalence during lockdown. Another meta-analysis divided the results based on gender, and there were three populations: general healthcare professionals and COVID-19 patients and healthcare workers. So here is the results. So generally, what we see here is what we know generally, that females report more sleep problems than males. But here we also see the same pattern, that the COVID-19 patients report more sleep problems than the general populations, and that also healthcare workers report more sleep problems than the general population. Another meta-analysis, and many of these meta-analyses did not focus on sleep only, but also had a lot of various mental health problems, which they related to the COVID-19 pandemic. And this meta-analysis, 14 of the 55 studies had measures of insomnia. And here we can see the results. The prevalence of insomnia in ordinary citizens was here estimated to be 16%, and in the healthcare workers, it was estimated to 24%. And another limitation that I also can mention already is that for most of these meta-analyses, most of the studies are from China. And in some of these meta-analyses, all the single studies are actually from China. So of course that puts some limitations in terms of the ability to generalize the results. In this meta-analysis, 44 studies on sleep problems in various groups were identified. And here is again the prevalences, and again the same patterns seem to emerge, that infected patients report the highest prevalences, and then lower in the general population, a little bit higher in healthcare workers here than in the general population. In this meta-analysis, there were a total of 50 studies, and some looked at different mental health problems. Of these studies, 7 looked at poor sleep quality, and 5 specifically looked at insomnia. So here again, the same pattern emerge. Infected patients report the highest prevalences. The lowest is found in the general population, and in the middle, we find the prevalence rates for healthcare workers. In this meta-analysis, there were 43 studies included in total. Here we have the results from the meta-analysis. This was, in my opinion, one of the most interesting meta-analysis, because what they did here was that they compared the results to pre-pandemic conditions. So they tried to estimate actually how the prevalence had kind of increased or been influenced by the pandemic. There were 4 studies on sleep-related symptoms in the general population, 4 in healthcare workers, and 2 in infected patients. And there seemed to be a higher prevalence or score on sleep-related symptoms in the general population following the pandemic, and also in healthcare workers. But when we look at the confidence intervals, this is not a significant increase. And actually in infected patients, compared to other patient groups before the pandemic, there's actually a reduced level of sleep-related symptoms that is reported. So this meta-analysis, I think, is one of the best in terms of trying to estimate if there has been a change due to the COVID-19 pandemic. And a limitation, I think, which concerns a lot of these meta-analyses is that they more or less only report data from cross-sectional studies, and people then report a high prevalence of sleep problems. And I think the authors typically concludes that this shows that the pandemic had taken a large toll on people's sleep. However, it's impossible to say anything about how the level of sleep problems was before the COVID pandemic. So I think due to the design of these studies, it's actually difficult to say anything specifically about cause and effect. Still, it's a clear tendency that people do this in these analyses. This is a study, this is a meta-analysis included 71 studies. In total, 17 of these studies in that meta-analysis included measures of insomnia. And this is various populations collapsed, and the overall prevalence here is 30.3%. We see also here that most of the studies it's actually from China. And also many of these, in terms of the meta-analysis that has been published so far, most of these meta-analysis has actually been based on data which was collected relatively early in the pandemic. Here is another meta-analysis on insomnia and poor sleep quality. 14 papers looked at insomnia and 6 at poor sleep in the general public. Here there were no, in the poor sleep quality, there were no data from healthcare workers. But we see that the prevalence is relatively high in terms of poor sleep quality. In terms of insomnia, it's somewhat lower, a little bit higher in healthcare workers. Sheraton published meta-analysis on 5 observational studies in healthcare workers, where they compared the results in non-healthcare workers. And here this odds ratio, only 2 of the studies included insomnia. And here we can see the odds ratio. So if you are a healthcare worker, there is a double risk of having insomnia compared to if you are not a healthcare worker following the COVID pandemic. Yeah. And this is also a study, meta-analysis on 66 observational studies. 11 of these reported prevalence of insomnia, and it was broken down by different populations. And we can see that physicians and nurses had the highest problem rate of insomnia. And also other medical staff had a relatively high prevalence, but much lower in the general population and in students. This meta-analysis included in total 74 studies. Here we actually try to estimate the prevalence of mental health problems both during the SARS-CoV pandemic and the COVID pandemic. In terms of insomnia, it was only reported during the COVID-19 pandemic, and it was 8 studies which were included here, and overall prevalence of 26.5% was reported. So yeah, that's and the presentation in terms of the results from mixed populations. And it's fair to say that COVID patients report the highest prevalences, general population the lowest prevalences, and in the middle, healthcare workers is located. And then I identified 3 studies on the general population. And in this meta-analysis, which is published in Scientific Reports, 15 studies included measures of insomnia and poor sleep. And in this study, they broke the results down on different geographical regions. And as we can see, there are huge differences in African regions. A prevalence of insomnia or poor sleep was only 15%. In the Southeast Asia region, the prevalence was 54%. In European regions, 30%, and in Western Pacific region, it was 25.6%. So the overall prevalence was 27.6, but as we see, there are huge geographical variation. This meta-analysis looked at actually the relationship between fear of COVID-19 using the fear of COVID-19 scale and various outcomes. And 3 papers looked at how the results on this scale correlated with insomnia, measures of insomnia. So here we can see that the COVID-19 fear scores correlate positively with a lot of different outcomes, and it had a correlation of 0.27 with insomnia, somewhat lower than for other outcomes such as anxiety and stress, which I think is reasonable because anxiety is more related to fear than insomnia. But still, it was a positive correlation. But of course, the methodological problems is that most of the studies were based on cross-sectional design, so it's difficult to say anything about the directionality in terms of the relationship. And this is the last slide I have on this general population. This meta-analysis was based on healthcare workers and general populations of India, and only 4 studies based on a general population concern sleep problems. And here we see that the prevalence is estimated to be 26.7%. So then I move on to the studies on the prevalence of sleep problems in healthcare workers. I don't think we need to go into detail on every meta-analysis there. That was by far the most common theme in terms of these meta-analysis I was able to identify, looking at how the sleep of healthcare workers was affected by the pandemic. And in this meta-analysis published in Journal of Psychosomatic Research, 93 papers were published, and 18 of these 93 papers concerned sleep disturbance. And here we can see the results. Here we can see that the overall prevalence of sleep problems in healthcare workers was estimated to be 43%. Again, a limitation is that most of these studies are cross-sectional, and in this case also the vast majority of these is actually from China. And also a general problem in this field when it comes to sleep is that more or less all single studies included in all these meta-analyses is based on self-report only. I was not able to identify any meta-analysis which actually included objective sleep data or recordings following the pandemic, which of course is a limitation. In this meta-analysis, a total of 65 papers were identified. And only 11 of these looked at insomnia and 5 looked at impaired sleep quality. So here's the results when it comes to insomnia. So the prevalence is here estimated to be 27.8%, and when it comes to impaired sleep quality, it's actually estimated to be 64%. So very high prevalence of impaired sleep quality in healthcare workers. Most of these also were from China, but some studies were also, I think, from Italy. Bush published meta-analysis on different mental health problems in healthcare regarding epidemics and pandemics in general. And here the prevalence of approximately 40% in healthcare workers were reported during such situations. Another meta-analysis by Pablo, published in Journal of Affective Disorders, included 40 studies on the prevalence of different mental problems in healthcare workers exposed to different types of viruses, coronaviruses, and 6 papers reported on insomnia. So here we can see they compared the insomnia results related to the SARS virus and the COVID virus. So we can here see that the prevalence is higher in healthcare workers exposed to the COVID virus. However, it should be taken into consideration that most of these studies on the COVID is probably published in the early phase of the pandemic, which might have influenced the results. This is a study specifically on Egyptian healthcare workers. Only 2 of these 10 studies in that meta-analysis focused on COVID, and the prevalence of sleep problems here was estimated to actually 58%. This is another meta-analysis by Hawaii, published in Frontiers in Psychiatry this year. Included 20 studies on various mental health problems and 5 papers reported on insomnia. And here we see several interesting results. Here's the insomnia prevalences, and we can see that the overall prevalence in healthcare workers is 44.1%. But in this meta-analysis, they broke the results down by the different kind of measures, the different types of self-reports which was used. This refers to the Pittsburgh Sleep Quality Index. So if you use a cutoff of 7, the estimated prevalence of sleep problems was 65%. Another instrument commonly used for assessing insomnia is the Insomnia Severity Index, and with a cutoff of 8, they report a prevalence of 31.2%. So this actually also shows a very important problem or limitation of these meta-analysis, that the results depends heavily on the instruments used and the different cutoffs that people use when they estimate the problems. And if they looked at moderate to severe insomnia, where they actually increased the cutoffs, the prevalence rates was significantly lower, 11.8%. Still, we see the same pattern. The Pittsburgh Sleep Quality Index provides much higher estimates than, for instance, in other instruments, the Insomnia Severity Index. So this also is a limitation in the field. This meta-analysis included in total of 83 studies of healthcare workers. 21 of these looked at insomnia, and the overall insomnia prevalence in this study was about 44%. Yeah, so I think I can go more fast through some of these. This is another meta-analysis, mostly conducted in Asia. The single studies included here, and the prevalence rates vary significantly. The overall average prevalence is estimated in this meta-analysis to be 44%. That is the prevalence of sleep problems in healthcare workers after the pandemic. Another study looked at insomnia. 5 of these 13 studies looked upon or reported data on that. And here the overall prevalence was estimated to be 34%. Here also we see that the instrument used has a significant impact on the results. The Athens Insomnia Scale seems to provide higher estimates than the Insomnia Severity Index. This is also a meta-analysis by Solari. 7 studies looked at the prevalence of sleep problems among healthcare workers. And in hospital nurses, the prevalence was estimated to about 35%, and 42% in hospital physicians. I think maybe we can go a little bit faster through some of these next studies. I can just stop with the studies which are of most interest. This basically shows overall prevalence, this meta-analysis by 38%. Another meta-analysis published in Frontiers in Psychology this year estimated the prevalence in healthcare workers of sleep problems following the pandemic of 32%. Another prevalence reported prevalence of 38% in healthcare workers. Here only 2 of the studies in total included in these meta-analyses reported on insomnia. And here 17 study looked at only Chinese hospital working healthcare workers. Prevalence of 45% was reported here. And in this meta-analysis by Jan, published in Psychosomatic Medicine, an estimate of 41% was the estimated prevalence of insomnia. This is an interesting meta-analysis, a so-called cumulative meta-analysis. And here they included 26 studies in total. 8 of these looked specifically at sleep problems, and it was in Chinese healthcare workers. When you do a cumulative meta-analysis, you include in the first estimate here the results from the first included study. The second estimate includes the results from both the 2 first studies, and the third estimate accumulates the results across the 3 first studies. So, and what they did in this meta-analysis, what they looked at the timeline. So the first study was the first that was published, and what we can see is that in the early phase of the pandemic, the prevalence rates of insomnia in China was reported to be relatively high. But later in the pandemic, we see that the accumulated results in terms of the prevalences goes down. So it might indicate that in the early phases of a pandemic, the toll the pandemic takes on sleep might be higher than in the later phases. That is at least one possible interpretation of this result. The next is studies on prevalence of sleep problems in students, and only 2 of these meta-analyses was specifically concerned about that. Here, they overall included 27 studies in this meta-analysis published in healthcare, but only 3 of them was related to impaired sleep quality. And here, actually 50% of the students reported impaired sleep quality. Deng did meta-analysis published in Psychiatry Research on mental health problems in students in higher education in areas affected by the COVID-19 pandemic. 14 of the included studies looked at sleep disturbance. And here we can see that overall prevalence sleep problems reported by students is 33%. But again, we see that it varies in relation to the instrument used. Quite high prevalences is reported when you use the Pittsburgh Sleep Quality Index. When you use the Insomnia Severity Index, it seems that the results are somewhat lower. The prevalences are somewhat lower, but it also, of course, depends on the different cutoffs that are used for the specific instruments. So basically, I think many of the results reported is rather arbitrary, because it depends on which specific cutoff and which specific instruments that are used. And then it was identified 4 meta-analyses which looked at sleep problems in COVID-19 patients specifically. And here they looked at insomnia specifically as a kind of sleep disorder. And I was a little bit surprised that in this meta-analysis, only 15% reported insomnia as a sleep disorder among these patients. However, other studies report higher prevalences. In this study by Deng, there were estimated prevalence of sleep problems in COVID-19 patients, and the overall prevalence was 34, but also here it was related to the different instruments and cutoff used. In another meta-analysis, also by Dong, published in Journal of Affective Disorders, it was 44 studies included, and 5 of these reported on insomnia. And here we see that the insomnia prevalence in the patients were very high. Actually, 68% of them reported that problem. And then and Liu published meta-analysis in Journal of Psychosomatic Research also this year. 22 studies, and of which 7 reported on insomnia. And here we can see that overall the prevalence was estimated to 48%. But again, we can see that the instrument mattered a lot. When using the Pittsburgh Sleep Quality Index, 85% of the patients were diagnosed with insomnia. However, when they used the Insomnia Severity Index, the prevalence was actually 37%. The next is meta-analysis, which looked at the prevalence of sleep problems in special populations. And actually, one meta-analysis looked at pregnant and lactating women in the area of the coronavirus. Here on various mental problems. Here, 19 studies in total were included, but only two of these had insomnia as an outcome. And these women reported an overall prevalence of insomnia of 33.5%. In another study looking at pregnant and postpartum women during the COVID-19, a total of 23 studies was included, but only 2 of them had insomnia as an outcome, and an overall prevalence of 49% was reported. So it seems that women who are pregnant or postpartum or lactating have a relatively high prevalence of insomnia, which may be due to the COVID-19 situation. Another meta-analysis looked at various mental health problems in children and adolescents. They included 23 studies in these meta-analysis by Ma, published in Journal of Affective Disorders, but only 2 of these reported on sleep disorders, but it was relatively high percentage, 44% in this meta-analysis. And then one meta-analysis looked at various mental health problems in children, adolescents, and caregivers due to lockdown and quarantine. They included 15 studies, but they did not in this study report on how many actually that reported on sleep problems, but the estimated prevalence of sleep problems in this population was 21.3%. And then there was a meta-analysis on sleep problems among children and adolescents during the pandemic. For young children, it was mostly the parents who answered the questionnaires. And here we see that this is a quite also interesting meta-analysis, because this also tried to say something about the real impact of the pandemic. Here we see the prevalence of any sleep disturbance, which was quite high. It was 54%. But then they actually compared, some of the studies had also data on prevalences of sleep disturbance in children before the pandemic. And actually, the risk ratio of having a sleep problem was actually reduced, although not significantly, following the pandemic. And the lowest forest plot we see here shows an estimate of the number of proportion of children, percentage of children who do not meet the sleep duration recommendations during the COVID-19 pandemic, which is then estimated to 50% or 49%, which is quite high. But again, it's very interesting when these meta-analyses include also pre-pandemic results, because then the findings are not so convincingly in terms of concluding that the pandemic has actually caused a lot of sleep problems. The next meta-analysis concerned sleep problems in the post-COVID syndrome. And this was published in eClinical Medicine this year. They divided studies into two different types, what they called acute post-COVID, which there is a follow-up shorter than 12 weeks following the infection, and chronic post-COVID, where the follow-up is 12 weeks or more following the infection. And indeed, this meta-analysis, they also tried to identify different clinical features and predictors of this syndrome. 30 studies was included. Only 4 studies looked at sleep disturbance as a symptom in chronic post-COVID syndrome, and it estimated that sleep disturbance has a prevalence of 44% in chronic post-COVID syndrome. There were no data for acute post-COVID syndrome in terms of sleep. And then some studies have looked at sleep as a prognostic factor for outcomes of the COVID-19 infection. And I was able to identify 3 meta-analyses on this topic. And here they looked at different prognostic factors with any adverse outcome in COVID-19 patients. This was a huge meta-analysis, including a total of 428 studies. And they looked at 91 different prognostic factors. I have only focused on those that are sleep relevant and then actually pertains to sleep apnea. So people with sleep apnea seem to have a double risk of hospitalization, as we can see here. And they also have an increased risk of intensive care unit admission, and also, unfortunately, a somewhat elevated risk for mortality due to the COVID-19 infection. Another study looked at much the same thing. They looked specifically at OSA-related factors and outcomes of COVID-19. They compared OSA patients with controls. And here we also see much the same, that the risk of severe COVID is increased in patients with obstructive sleep apnea. And also the risk of intensive care admission is increased. Need for mechanical ventilation and also mortality is increased in these patients. And the final meta-analysis on prognostic factors is based on a study from Finland, where they also included some results from other studies looking at how sleep apnea can be a predictor of outcomes. So the FinGen studies was the original data from Finland, and they also added in the meta-analysis results from other studies showing if sleep apnea is a risk factor, in this case for hospitalization. So we conclude that there is a significant increased risk for hospitalization for COVID in these patients suffering from obstructive sleep apnea. However, when they controlled, which show in the lower panel here, for different covariates such as age, sex, and BMI, the association is no longer significant. But of course, that might be related to the fact that they had relatively few studies included in this meta-analysis. And the last meta-analysis I was able to identify was this, where they actually investigated the impact of various non-drug interventions on anxiety, depression, and sleep in COVID-19 patients. And controls were patients not given this treatment or only receiving prophylactic drugs. And here there were only one study. They included 5 studies in total, but only one of these studies concerned sleep. But here we see that on this sleep state self-rating scale, there is a significant increase increase in good health. That is the decrease in symptoms of insomnia with a relatively high effect size, and also the confidence interval shows that this is significant. So that was a very fast sum up of the meta-analysis I have been able to identify when it comes to the relationship between the COVID-19 pandemic and sleep. The conclusion I think can be drawn here is that the highest prevalence of sleep problems is seen among COVID-19 patients compared to other groups, and also that there is an elevated prevalence of sleep problems among healthcare workers compared to other groups. And studies do indicate that frontline workers are more affected than non-frontline workers. And also it's fair to conclude that sleep apnea seem to be a significant risk factor for more adverse outcomes of COVID-19. There's been a lot of discussion about why is it so that sleep might be affected by the COVID-19 pandemic. This slide shows some of the potential mechanisms. People might be scared due to the pandemic, which of course can impact sleep negatively. Lockdown causes social isolation, which might also influence sleep. If people work from home, they don't need to get up or rise at the same time as before. So delayed bedtime might also influence sleep in a negative way. Difficulty complying with compliance to new rules, ambitious messages from healthcare workers and governmental institutions, social isolation, being frontline worker, fear of contracting the virus, different precautionary measures in workplace causing stress, older age, and more work for healthcare workers. Some of the mechanisms that has been suggested. However, when I went through this literature, I was struck by the huge amount of methodological limitations, which really curbed my enthusiasm for the results reported. And I think that many authors, they draw the conclusions far too far in terms of what there is scientific basis for. Many of these studies are only cross-sectional studies. So if you then have a high prevalence reported of a sleep problem, it's difficult to say if it's due to the COVID-19 situation or not. Another problem is that the vast majority of studies come from China, which of course limits significantly the ability to generalize the results. Extremely few studies are based on representative samples. Many of these, or most of the single studies included in the meta-analysis is based on convenience sampling. So the actual prevalence is actually very difficult to say anything about in the general population. And almost all studies are based on self-reports, where there is a risk of common method bias, recall bias, and demand characteristics. I will guess that people who are asked to report on sleep during the COVID-19 expect the researchers to expect or assume a high prevalence. And of course, that can by itself influence how people report. There's been use of different cutoffs and sensitivity of different instruments, as we saw in some of these meta-analyses, which actually implies that the results can vary significantly based on the instrument one uses and a specific cutoff one uses. And many of the studies conducted, at least those included in the current meta-analysis, are based on the early phase of the pandemic. So we don't know actually how things might change during the pandemic. And what really surprised me was that no study did actually no meta-analysis looked at changes in sleep routines, such as bedtime, rise time, or circadian parameters, which I really think also would be of great interest. Some studies have shown that during the pandemic, people seem to go to bed later and rise later following the pandemic. And also another methodological limitation is that absolutely no of the single studies included in these meta-analysis had actually was based on objective sleep data. So basically, I think the threshold for publishing studies in general following this pandemic has been significantly lowered, which also shows, I think, in these meta-analysis.